So I usually take 2 photos, smile and retracted. But now I'm taking exaggerated smile just for this one reason here, just to see if they show any pink. And his case is unique because he has already 6 implants in his maxilla. His front 4 teeth are decayed, and he just needs those teeth out and needs to be converted. We can't remove bone anymore because the implant's already in position. We're really just here to convert him from natural teeth to implanted teeth and take out his, and we're gonna do the same thing for the top as we are for the bottom. So my protocol for a case like this would be able to take these 3 photos just like this, and then I take intraoral scans. So I take an upper and lower intraoral scan and a bite scan, and I do this if the patient is, their CR is correct. If it's not correct, then I take a CR bite. I'll tell you, I had lots of issues with bites whenever I think patients are in a stable occlusion and they're actually not. So if I can tell that they're not, I take CR bites. If I'm unsure, I take a CR bite. And if I'm not able to get to the room, I just have my task take a CR bite, so I know that the condyle seats fully in the fossa, and I'm getting a really good bite, and I can recreate their bite in exocad. And this is the upper and lower scan. This is just from our Medit scan, and this is his bite before and after, or before. Now we're gonna what we're gonna do is send all this information out to the lab. And what the lab does is they take the photos of him and stitch it to his teeth, and then his teeth get mounted on an articulator, right? I use a penitent articulator and make sure that I go through all lateral excursions to make sure this thing's mounted properly before I start my surgery. My surgery is pretty easy for this case because the implants are already in, but I'm gonna show you like the walking through the concept for this case. So you have to have common stitching points, kind of like we did when I first showed you the OptiSplint. So I'm removing the crowns from these. I have an intraoral scan of the upper arch that's already taken. I'm removing the back teeth crowns, putting in multi-unit abutments, and scanning them with these 6mm multi-unit abutments, scan healing abutments. I'll show you what those look like later on. These are my favorite ones on the market. They work really well for FP1 and FP3. They're just the best universal scan body that I've used. So the common stitching point for this guy, you can use fixation pins if you want to, but I'm going to use his teeth as a reference. So his teeth are going to be my reference. So these 4 front teeth, these 4 front teeth are going to be my common points. Now, once I take these last teeth out, I'm going to recontour the tissue and the bone in this area to stay FP1 and prevent his pink tissue from showing. I'm going to reduce some bone and contour the bone in this area and take my final scan. All these can get cross-mounted and cross-stitched back. So I'll send this off to my lab, and they're going to wax up his teeth, right, from his original scans. They're going to wax up his teeth and remount it and make sure everything looks good, and send me the STLs, and I'll just 3D print them. And I did that for his upper and his lower. So this is the day after surgery. This is the very next day. See, he's not even that swollen, but his lips are a little messed up from the day before the procedure. This is provisionals, before and after results. Just some side profiles of his before and after results. This is his Panorex before and after. And this we printed on a Sprint Ray printer, a P55S, the new printers, with Sprint Ray on X Tough at 100 microns. And it took 35 minutes, and then we can deliver this. And that's the whole OptiSplint protocol, which is great. If you're using iMetric, that's great too. There's actually a library for this screw. It's called the Levy library. You can use 0.2mm seat or whatever seat you want. If you don't have this library, I can send you a video on how to use it and send you the library itself, or just reach out to Transcendental and ask them for it and they can give it to you.